Hi, I'm Dr. Timothy Rodgers with Rodgers Dermatology here in Frisco, Texas. Today I wanted to talk to you about Kybella and demonstrate the procedure. It's a new product that's recently been approved by the FDA to treat a double chin, or what's called submental fullness. It's this fullness here underneath the chin and also the laxity. So as everyone gets older, these fat pockets underneath here tend to get bigger. Even if you lose weight, they often don't go away, and you also tend to develop some laxity. So when we inject it into the skin, it breaks up those fat cells, they're destroyed, and you don't get new ones. So it's a permanent solution for this area, and it's a nice alternative to things like liposuction. It usually takes anywhere from 2 to 4 treatments, spaced about a month apart, relatively painless and easy. Side effects are sometimes a little bit of a bruise, feeling a little bit swollen there for a few days, and that's really about it. The first thing we're going to do is put some marks on Susan to map out exactly where those fat pockets lie. So we're using a grease pencil to mark to begin to establish where these lines will be at where we can inject the Kybella. And these are sort of like a temporary tattoo. So we apply the grid on the area we're going to treat, wet it with some water, and we'll remove the template. And now we use the very tiny needle again to inject the actual Kybella. We determined she would need about 6 syringes, which is 3 of these Kybella vials. You might feel little pinches here and there, but shouldn't be too bad at all. Here's the first pinch. How's that? Not bad? Okay.
Not bad at all.
So we'll just start going sort of from side to side here. And the injection goes underneath the skin into the fat pad. And Kybella will actually begin to work within just about 10 to 15 minutes will be when it peaks at the destruction of the fat cells. You do tend to get what people have described as sort of a pelican neck, where you get a lot of volume here. That does not last very long. That goes away very quickly, but there's really not too much downtime associated with this procedure. But you do want to give yourself probably a weekend to recover in case there's a bruise or some swelling. And that's really it with the injections. So now I'll just clean off the dots, the temporary little tattoos. So Susan, on a scale of 1 to 10, if 10 is horrible and 1 is easy, what's the rating on something like Kybella procedure?
I would say a 2.
A 2? That's pretty normal. People usually say 2 or 3 is where they said it's a little pinchy, and but certainly easier than having surgery. You can see that she'll be a little swollen in that area where we did the injections. Like I said, that's a temporary effect. That volume will be absorbed. The Kybella is already working to destroy those fat cells. And then when it gets taken out, your body will remove the lipids and drain it out through the lymphatic system. So that's Kybella. It's a new injection recently approved by the FDA to treat the double chin or the submental fullness. If you'd like to learn more about Kybella, you can find it at our website, www.rodgersderm.com. You can also call our office at 972-704-2400. We're in Frisco, Texas. Thank you.